Hi. Divers dive, and divers sometimes get bent, and when they are bent, they need hyperbaric oxygen chamber therapy. Now, if a diver suffers from decompression sickness, how many sessions of hyperbaric therapy should he get? The reason I prepare this presentation is recently I received a text message from a lady about I have decompression sickness symptoms and I have had it for over a month. So what should I do now? Is it okay even if I go to the chamber now? And my answer was, of course. It is late. It may take many more sessions, but still, if you do have the typical symptoms of DCS, you probably need hyperbaric therapy. So to talk about that, I will start from the symptoms of DCI, first stage. In fact, I have talked about this in different presentations about diving medicine many times before, but let me briefly cover the first aid, when to go to the chamber, and some indications for hyperbaric therapy, and then how many sessions for DCI, and when can we go back to diving after hyperbaric chamber therapy. So it's the symptom. I wish everybody can keep the symptoms in your logbook, so that if you feel strange after diving, you should look it up if you don't remember everything. Weakness, fatigue, unexplainable fatigue, some myalgia, arthralgia, and then comes neurologic symptoms, which is really serious, and that includes numbness, tingling, needle pinching. Also, a severe case of neurologic symptoms include consciousness change or personality change, loss of consciousness. Then we have other symptoms like lump in the throat or skin rash, urticaria, pruritus, itch, lymphatics, edema, vestibular, vertigo. Excuse me. Hematologic, you have bleeding and bruise. And those bruise, they form in a big type. Also, you can fall into shock. So the first aid is always 100% oxygen. What if it is not 100%? What if there is no oxygen in the resort? If you have nitrox, like 32%, it's still better than breathing air. So try to get oxygen when you have the symptoms. Also drink a lot of water and take not really recovery position in the classical form, but you can take the best and most comfortable position. And then it's about when we should go to the chamber. It's ASAP. As soon as you feel any symptoms of DCS, it's better that you go to the chamber. And when you feel the symptom within 24 hours after diving, probably you have decompression sickness. So it is better that you go to the chamber as soon as possible. Hospital might do something else as well, giving you fluid, giving you, excuse me, giving you some anti pain or inflammatory drugs, but those all fall into the therapy category. But eventually, hyperbaric chamber therapy is what you take. And if you delay the treatment, it can cause sequelae and complications and some or many additional sessions. So it can also proceed to worse DCS symptom. There are quite a excuse me. There are quite a number of indications please forgive me. There are quite a number of indications for hyperbaric oxygen therapy. Of all disease, decompression sickness, decompression illness is only about 5 to 10% of all therapy. And decompression sickness also is there, but there are quite a number of other diseases that I'm not going to talk about. There are quite a number of diseases that doctors are in a way experimenting if it really works. And those includes AIDS, allergy, Alzheimer's, asthma, arthritis, autism. And it looks like they believe early stage autism can be even treated with hyperbaric oxygen. Some people say, Anyway, Bell's palsy, brain injuries, and there are many more disease that is under experiment now. So, how many sessions should we get for DCI? It depends on the modality or the treatment table that is being used. Some table you can even take 2 sessions per day, depending on how long or short the table is. Severity of symptom, time for DCS, from DCS to hyperbaric oxygen, personal susceptibility, sure, presence of complications or sequelae. These are the elements to decide how many sessions you should get. But in general, DCS usually takes 1 or 2 sessions only. Surprisingly, many bank divers, they get 1 session of hyperbaric oxygen therapy and they get completely okay. But my recommendation is always take 1 additional therapy after the symptom resolution. So to me, all DCS should take minimum of 2 sessions. Why? Let me give you the example in Korea. The chambers are sometimes like 2 hours or 3 hours away from where you live. Hyperbaric oxygen therapy is done by outpatient basis. So you take you take 1 session and you feel perfectly okay. You come back home, and in many cases you go back the next day. Driving for 6 hours with DCS symptom, it can mean something. So try to get minimum of 2 sessions, but it doesn't really work that way. Many people have many reasons not to be able to do that. Some doctors even do not recommend this. But you as a diver, who is bent should ask the doctor to give you an additional therapy. Delayed treatment can result in many additional sessions for a long time. When can you go back to diving after hyperbaric oxygen therapy? I also made another presentation regarding this, and it includes this PowerPoint, and 4 to 6 weeks mild and complete recovery, 3 to 6 months for severe case, serious DCS with complications, or sometimes doctors recommend you not to dive if you have had arterial gas embolism. So today I talked about how many sessions should we get when we are bent, and talked about the symptoms, first aid, which was like 100% oxygen with lots of water, when to go to chamber as soon as possible. Indications, there was a lot. How many sessions? Please take 2 sessions minimum. Usually 1 session can take care of the situation, but it is better if you get 1 additional after complete resolution. And going back to diving, 4 to 6 weeks minimum, I would say. So today's issue is how many sessions of hyperbaric therapy for DCI. Hope and wish you have pleasant and safe diving. Thank you very much.